Podcasting from eHealth New South Wales. This is Let's Talk eHealth.
Welcome to Let's Talk eHealth, a podcast designed to showcase the projects and people we have at eHealth New South Wales. Today we're talking about SafeScript New South Wales, the state's real-time prescription monitoring program. SafeScript New South Wales provides prescribers and pharmacists with real-time information about a patient's prescribing, dispensing and approval history for certain monitored medicines. I'm Danielle Johnson, Delivery Manager Cloud Services at eHealth New South Wales, and today I'm joined by Mary Fien. Mary is a Principal Business Analyst in the BA Capability Practice within Program Delivery. She brings with her an incredible background of experience, including valuable perspectives from her time as a critical care nurse with Northern Sydney LHD. Welcome, Mary, to the podcast, and thank you so much for joining us today.
Thank you, Danielle. It's lovely to be here.
So, Mary, you've been with Health for a while. Can you tell us about your role at eHealth New South Wales, and also tell us about what led you to work for New South Wales Health, and what did that journey look like for you personally?
Sure. So I'm currently a Principal Business Analyst with eHealth New South Wales, and being in the capability practice, that means I get the opportunity to work in different programs, and I've had several programs in my time in eHealth, which now runs to around 11 years. Prior to that, in New South Wales Health, I started off in the environmental health branch, way back in the days that we were located at Gladesville Hospital. And I did do some time as a critical care nurse, mostly at Royal North Shore Hospital, which gave me a whole new perspective on healthcare and the healthcare system. And after that, moved into research and then worked at the ACI for a time, the Agency for Clinical Innovation. And while I was there, I had the opportunity to work with some eHealth people on some EMR work for the program that I was in, and I liked what they did so much. I took the chance to come across to eHealth, and I've been here ever since in my niche in business analysis.
Awesome, Mary. It sounds like a wonderful journey to where you are today, and also very well-rounded with a mix of that clinical and behind-the-scenes experience there. So turning to SafeScript New South Wales, can you please give us an overview of the program?
SafeScript New South Wales as a program was known as Real-Time Prescription Monitoring and Approval Management. So in the first phase, the intention was to give prescribers and pharmacists across New South Wales a real-time view of their patients' prescriptions and dispensing events for certain high-risk medications. In the second phase of the program, we added functionality so that prescribers could use SafeScript to apply for and receive approval to prescribe certain high-risk medications where they were required to by law. So by doing that, that also gave visibility to other prescribers and selected stakeholders for those approvals.
Mary, can you, to help our listeners understand, explain a bit more about what it looked like before the program came into place? So that approval management process, how was that experienced by our clinicians and patients beforehand?
Yeah, so it was really quite burdensome. There was a lot of administration around seeking and granting approval. So the prescriber would have to fill in essentially a paper form, PDF, of multiple pages, get that signed, sent into the Ministry of Health, and then wait to receive approval wherever they needed this legal authority to prescribe high-risk medicines. So what the system did was not only give them visibility of whether there was an approval in place for that patient, for that type of medication, but it hugely reduced their delays in obtaining approval and therefore the access for the patient to their appropriate treatment. And this was a particularly crucial step where we're talking about patients with substance dependence who might have finally made the decision to go to a healthcare professional, and then they find that they have to wait for treatment because of this delay in getting approval. So for the prescribers, being able to get that approval often on the spot for that person and start them on treatment meant that they were no longer lost to follow up. They might not come back the next time, whereas if they could start it right now, then they've got somebody that they can start helping straight away and who will keep coming back to them.
Wow. So I'm sure it's helped a lot with the experience of patients and some of those delays, Mary. So now that it's out in the wild, what's some of the feedback you're seeing from our early adopters and users of the system?
Well, it's been amazingly positive. particularly for addiction specialists, psychiatrists, other prescribers who need to get these approvals on a regular basis. It has increased the amount of time that they can spend with patients because they've reduced this workload around really paperwork, calling people, trying to find out what's happening. It's all right there in front of them. They can do whatever application is needed on the spot, often get the approval on the spot or at least within a few days. So it's improved the quality of care that they're able to provide, and they've told us that they've found the system really easy to use.
I want to dig a bit deeper into the use of the system. So Mary, looking at the design of it, were there any guiding principles that you and the team worked towards through with your stakeholders, and how was this received?
Of course, in any program or project, there's only so much that you can achieve with the time frame that you have and the resources that you have. So if we were needing to weigh up the priorities of doing different functions or enhancements within the system, we would look at what's the size of the benefit. And often that meant, are we helping 10 users, 1,000 users? And that would help us to shape what priorities we had, what work we took forward, which ones we really invested heavily in. So as a result of that, we worked really hard on the interface for prescribers because there were so many of them working at such a high volume that it was really important to get that to a point where it was very intuitive and usable for them and would actually save them time rather than adding to their burden.
What are some key challenges that you experienced on the program, and how did you and the team overcome them?
We needed to migrate a lot of data around the approvals from a legacy system. It was complex and high volume work, and it did impact our overall project timelines and effort, but we needed to take a very thorough approach with that due to the sensitive nature of the information.
Of course.
Another challenge that we had was that we were running this technology project in parallel with a significant regulation reform. And because of the changes and at times uncertainties around that, it did impact the stakeholder experience with working with the system because they might be just getting used to how something had changed from a regulatory perspective.
A lot of challenges there, Mary, and you've talked a bit about the partnerships piece, so I want to delve into that a bit more. New South Wales Health, with all the complexities in our environment, for you personally, how do you see the role of partnerships across the system in delivering programs successfully, and how did this help SafeScript New South Wales along the way?
Well, partnerships, of course, are critical to what we do. We are delivering technology systems for people and people in a range of settings and contexts. So in this one, a little bit unusually for a lot of New South Wales Health projects, we're working with, hospitals, community health, really, inside New South Wales Health, whereas this program was much broader. So we had to work out a way to work with providers in the private sector. So we had prescribers who might be GPs, all kinds of specialists, community-based pharmacists. So we used the known networks, so the GP networks and also the pharmacy organisations, so the Pharmacy Guild and the Pharmaceutical Services Association, and also organisations like the RACGP. And by building the partnerships with them, we were able to really get that broad user engagement. We were looking at a user base of around 22,000 prescribers and pharmacists, and we really needed their insights to how they wanted to work with the system and what we needed to deliver for them. So that was an interesting challenge for us, really going well beyond our New South Wales Health boundaries.
So Mary, I want to turn to the patient experience a bit more. So can you walk us through what does that patient journey look like now that SafeScript New South Wales has been implemented?
Well, the patient journey initially will feel no different for the patient. So they will go to whoever their provider is, often a GP, potentially a specialist, if it's a psychiatrist, a neurologist, an addiction medicine specialist. But in the context of their consultation with that provider has access to their SafeScript record, so they can see if there are any concerns there around prescribing or dispensing history and look for any potential risks to the person that they might need to manage. it also allows patients potentially to get access to the treatments that they need much faster, because approval can be either immediate or within a few days, and they can start on the treatment that they need. So for the patient overall, it's a more streamlined experience, but it's also a safer one because their provider is aware of any risks that might exist when they're seeing the patient.
Mary, that sounds incredible. It's achieving so many benefits to patient safety, access to care sooner and quicker, and that continuity of care. So Mary, looking back at the program, what do you believe has been the biggest success of SafeScript New South Wales?
The biggest success for SafeScript New South Wales was the high uptake rate by those prescribers and pharmacists. It's not a system that's mandatory to use in New South Wales. There was that approach taken in other jurisdictions, which came with its challenges. In New South Wales, we've always stayed with a voluntary system. In the context of that, we've had extremely high uptake by the priority prescribers, GPs, addiction medicine specialists, psychiatrists. When we did go out and survey them about their use of the approval management functionality specifically, but also SafeScript in general, we had almost 1,000 respond to us, and we had a 78% satisfaction rate.
Wow.
Which is very high for any information system, particularly one where we're not able to go out and train or support users individually.
Incredible work, Mary. Is there anything that you would do differently looking back at the program, or key learnings that you have to share with our health practitioners listening?
I think the thing that potentially we could have done a little bit differently was really around timing. As I said, we were running alongside a regulation review. It just meant that there were some complexities that perhaps we could have avoided if the regulatory reform process had started a little bit ahead of the technology. It wasn't entirely a bad thing because it did allow us to really think about how we wanted prescribers to interact with that approval management side, and perhaps drove some of the thinking in that regulatory space as well. But it would have been simpler if we'd had the regulation ahead of the technology.
Reflecting on the outset of the program and some of your stakeholders, can you tell us a bit about how they were feeling, and how did that shift throughout the course of the program, and what did you do to bring them on that journey?
One of our significant stakeholders was Justice Health. They had quite a big workload around managing opioid substitution therapy for people in public and private correctional facilities across New South Wales. And it was quite labour intensive for them. They had to maintain lists of people that had to be cross-checked with their justice system so that they understood who was in there, who needed therapy, what their approval status was for that therapy. And often that would involve them calling the Ministry of Health or sending over spreadsheets, sending over updates. There was just a lot of work involved. So when we first approached them, there was a little bit of hesitancy. They really made it clear on a couple of occasions that whatever we did, we couldn't make their lives any harder because the workload was already quite heavy with this process. What we were able to do through a series of sessions and engagements was to really understand the details of their workflow and how the system could actually support that and make it easier. And they brought up scenarios that we hadn't thought of, like a person having their first contact with the justice system on a Friday evening, indications that they might need opioid substitution therapy, but there was nobody that they could call to find out about that until Monday. So they would have to manage that person over the weekend, try to keep them healthy and safe. And what we were able to do was deliver them a system that all of the appropriate people across Justice Health and even the private correctional facilities had access to. So as soon as somebody came in, they could look them up, find out what their approval status was, start that therapy, if appropriate, immediately. And that was a great benefit to people who were quite vulnerable, potentially their first contact with the justice system. And instead of being left to cope with all the other things that were going on for them, they could start their treatment immediately and just have a much better entry to the system, be cared for, be well. And it was a hugely reduced workload for the Justice Health staff as well. So in the end, we got really warm feedback from them. They were really keen to tell us how much it had actually improved the situation for them.
Mary, it sounds like it's been a whirlwind program and immensely successful. Turning to you personally, what do you do outside of work to unwind and stay above the fray?
Well, I have a variety of interests, but the one that really keeps me happy and grounded and takes the stress away is my ocean swimming. I love the feeling of being in the fresh, cool water and also looking at the fish. Sometimes people ask me what I think about when I'm swimming, and generally it's 1, 2, 3, 1, 2, 3, 1, 2, 3, counting my strokes between breaths. So it's the most amazing free meditation program you can get, just swimming along in the water, nothing to think about except how many strokes you've taken between breaths and when a beautiful fish might pop up in front of you.
Sounds incredible, Mary. I'd love to join you sometime. Reflecting upon your time with health, do you have any words of wisdom or advice to share with someone that might be looking to join New South Wales Health?
New South Wales Health is a great place to work if you want to get up every day and know that your work will have a meaningful impact. In all of the projects that I've worked on, the greater good has been a real driving motivator for everybody in the project, and not just the people that you would assume have that motivation. So people, with a clinical background, that sort of thing. But I've found that even the people in eHealth who are doing the most incredible technical work, it's still their reason. They still know that the work that they do can have a positive impact on hundreds of thousands, millions, potentially every person in New South Wales. And it's a real motivator for the work that we do and for really knuckling down when times get tough.
Mary, thank you so much for joining me today to talk about SafeScript New South Wales. It's clear that this is an important program and it's already genuinely improving patient outcomes and reducing the administrative burden for our clinicians. Congratulations again to you and the team on all the work that you've done.
Thank you so much. It's been a pleasure to discuss it with you today.
For our listeners, if you are interested in learning more about eHealth New South Wales' involvement in SafeScript New South Wales, please head to our website at www.ehealth.nsw.gov.au. You can also find the link in the podcast show notes.
Thanks for listening to Let's Talk eHealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.